I watched Cam go through this and I hope I can mimic his hand movements from where he was. I would also be remiss if I didn't take a moment to acknowledge the amazing team that I have behind me at the University of Calgary. The HTA unit is an amazing group of people, and it's a real privilege to work with them every day. Nope. There we go. Okay. So I have about 20 minutes, and these are the things that I'd like to talk to you about during that time. So exploring the public perceptions of cannabis, to understand the gaps between the perceptions of cannabis and what the published evidence is pointing towards, and then to explore the public support for different policy approaches. And I'm going to achieve these objectives by sharing with you the results of a nationally representative sample that was surveyed in July of 2016. And we did this as part of the work that we were doing to help the government with their policy directions for cannabis, in preparation for cannabis legalization. So really, we've kind of thought about this as the pulse of the nation as of July 2016. Then we also paired that with evidence synthesis, systematic reviews primarily, which is a methodology to go out into the literature and find as much information as you can to answer a question, and then kind of compare those two pieces of information. So starting with the public support for legalization, as Cam already alluded to, most Canadians do support legalization, and as someone new to this field of study, I was surprised to find such high rates of support across the country. It wouldn't be surprising to most to know that support amongst users is higher than non-users, but notably, none of those groups have below 50% of respondents indicating that they do support legalization. When we looked at that across a variety of different demographic variables, so age, sex, income bracket, and education bracket, in 4 of the provinces that were included in our survey to be provincially representative, so kind of funneling down to that province level, again, you see that there is no group here that has less than 50% support across the country. Next, we asked about the harms. So what did the public think about cannabis harms? So we asked about harms to physical health as well as harms to mental health. And we asked respondents to indicate if they felt that cannabis was more harmful than helpful, more helpful than harmful, had no impact on either aspect of health, or they were unsure. And you'll see that about 40% indicated that they felt it was more harmful than helpful to physical health, and a slightly higher percentage, but not a whole lot more, felt that it was more harmful than helpful to mental health. When we asked them to think about that impact on physical and mental health in relation to other commonly used substances, so tobacco, alcohol, prescription drug abuse, and illicit drugs, other than cannabis at the moment, you can see that for me, this made sense to where I would intuitively have put cannabis in my own head. So I would kind of have ranked it, just to orient you to this graph. I'm used to a pointer, so that's why I keep doing this, I'm sorry. The top half of that graph is the percentage that indicated the substance was more harmful than cannabis. That lower half is the percentage that indicated they felt the substance was less harmful than cannabis. So again, for myself, just benchmarking it where my own opinion would have put it, I would have put it kind of below cigarettes, slightly below alcohol, less than prescription drugs, and definitely less harmful than where I would put things like cocaine and methamphetamines and other drugs like that. So you see that the majority of Canadians kind of put that in the same place as I would. Now, what does the evidence say? So what we did in this part is, because there has been a lot of synthesis literature put out in very specific kinds of impacts on health, we went out and looked at all of the systematic reviews that have been published in this area. So there are 64 of them that look at the association, and that's important to remember, this is an association, not a causation, that looked at the association of marijuana use and the particular outcome of interest. So we grouped it into broad categories, so cancer effects, overall health effects, impacts on mental illness, prenatal exposure risks, neurocognitive changes, and then structural, chemical, and biochemical changes to the brain. And really what you see, and each of those points represents the findings or the conclusions of one of the systematic reviews that we found in relation to the outcome. So really what you see here is that of the things that we know, the majority of them have been documented or classified in the harmful range. Very few have been put down in the no harm range. And again, remember here that we're not talking about magnitude of effect. So this is just the conclusion of the paper that looked at the summary of the evidence so far, concluded that there was harm. And I'm not putting numbers around how harmful. So what does the public think about addictiveness? This is the same as the last graph we looked at. So above the line means that they feel the substance we asked them to compare to was more addictive than cannabis versus less addictive than cannabis. And you'll see that the majority of respondents felt that cigarettes, alcohol, prescription drugs, and illicit drugs were more addictive than cannabis. One of the other common concerns when people speak about cannabis is that cannabis use leads to other illicit drug use, so that it's a pathway into harder drug use, as they might say. So we asked our survey respondents about that, and you see that about 35% of Canadians responded that cannabis use does lead to other illicit drug use. When we looked at what the evidence says, this is the similar approach. We did a systematic review documenting the literature we could find that looked at the pathways that people follow to hard illicit substances. And what you can see from this graph, and it's a bit complicated, but what you can see is that the initiation of substance use, often the first initiated substance is alcohol or tobacco, and then they move on to the other one, and then on to marijuana, and then on to illicit drugs if appropriate. So for most of the studies that we found, cannabis was the immediately preceding drug to other illicit drug use, but actually their chain of substance abuse started with something else. And important to note that there's a lot of contributing factors that move people down this pathway, as well as protective factors that kind of halt people at a different substance use. You'll also note that there is this pathway that moves into other illicit drug use first. So the first substance initiated might be cocaine, heroin, methamphetamine, speed, things like this. So important pathways to remember when we're thinking about this group and moving into harder things. The other thing that I wanted to flag here as we begin our discussions about youth prevention is that one of the contributing social factors or patterns of use factors to moving people down this pathway is age of initiation of substance use. So the younger you start, the more likely you are to move down this pathway. And that's an important thing to remember as we focus on youth prevention. So looping back to the policy directions that Cam introduced to you, this is the same graph that you just saw. And the other thing we asked about on the survey was the support for different policy approaches and regulatory approaches in the policy space. So when we asked about what the public thought the minimum age of purchase should be, approximately 70% indicated that it should be the same as alcohol and cigarettes. So that would be in most provinces 18, in a few exceptions 19 years of age. So this matches very well to the task force recommendations of a minimum age of 18. When we asked people how they thought it should be taxed, the vast majority indicated either similarly to alcohol or similarly to cigarettes. And again, this matches nicely with the recommendations that the policy framework puts forward of curbing demand through pricing, which is an approach that we use both with alcohol and cigarettes. We have very heavy taxes on both of those products with an attempt to try and decrease use through price regulation. We also asked about what kind of advertising should be allowed, and the vast majority of Canadians felt that no advertising should be allowed. So this would be similar to the way that we treat tobacco, alcohol, and prescription drugs, where no sponsorship is allowed, no advertising on TV is allowed, and so people put cannabis in that same category. We asked about where sales should be permitted. And you see there's two very strong options there within the pharmacy and specialized cannabis dispensaries. Also strong support for liquor outlets and wherever cigarettes are sold. So no clear winner here. High levels of support, in my opinion, for all of these options that are put forward. So that will be a piece that the task force and the government really needs to think hard about where they want to allow sales for this. And there's no clear alignment to the public expectations. And then the last thing that we asked about was about impaired driving, so asking people about where they ranked cannabis impaired driving in relation to alcohol impaired driving. And what I'll draw your attention to is the circles in the middle, which is the percentage of respondents that indicated they recognize cannabis impaired driving is as harmful as they think alcohol impaired driving is. Now, that's not necessarily to say that they understand alcohol impaired driving is dangerous, but to say that wherever they benchmark that in their mind is where they also put cannabis. And then importantly, there is a notable group in the green arrows pointing down that feel that cannabis driving is less harmful than alcohol. So this might represent, if we could figure out who falls into these different buckets, this could really drive some of the public campaign and public health messaging that we develop around impaired driving. So key messages coming out of this survey. The majority of the survey across many segments of the population do support legalization. There are significant harms associated with cannabis use that include mental health, neurocognitive harms, and cancers. There is an underestimation generally of the harms in the public, although they do recognize that harms exist. And perhaps the largest gap would be the area of addiction and dependency, where there is a gap between what people think in terms of risks and a mismatch between what the evidence is showing us that the risk actually is not cannabis use, but it's something else, and it's mediated by a lot of different factors with illicit drug use and dependency. And generally, there is public support for policy approaches that do protect the public health and the safety of Canadians. And we found that generally our respondents kind of categorized cannabis very similarly to alcohol and tobacco. So perhaps an opportunity there to leverage off some of the successes and some of the hard lessons learned in those fields as we try to regulate those for a much longer time period than cannabis. Thank you very much.